There is more evidence tonight of the barriers women face getting medical treatment. Called Surveying the Silence, the report gathered data from more than 2,000 Albertans, and it reveals women are consistently dealing with misinformation, misdiagnosis, inconsistent responses, and disjointed approaches to their health care. As many women know, too many things are still taboo, including menopause, endometriosis, and painful periods. Heather Yourex-West explains.
From the age of 10, Violetta Kondofsky has dealt with debilitating pelvic pain.
I wasn't believed for a long time, and the pain was really severe, and my family didn't know a lot about it. So my mother just thought some women have awful periods, and that was it.
Years later, Kondofsky would finally learn she has endometriosis. The painful condition impacts more than 1 million Canadians, and yet patients will wait an average of 5.5 years before they're even diagnosed.
We know that 50% of the population are assigned female at birth as women. It's still taboo to talk about many of the health issues related to their specific anatomy.
According to a new survey from the Alberta Women's Health Foundation, that taboo is putting the health of women, transgender men, and non-binary people at risk, keeping them from accessing help for a wide range of issues, things like polycystic ovarian syndrome, pelvic floor disorders, even menopause.
We certainly do have providers in community, particularly family physicians, that do have focused areas of women's health. And I think we need to advertise that better and make sure women have access to those providers.
But access to providers varies depending on where you live. In the southern Alberta city of Lethbridge, for example, where there were once 9 obstetricians, gynecologists, there is now only 1. Beyond finding care, the survey also found treatment effectiveness is also a major concern. Just 16% of women seeking care for perimenopausal symptoms were satisfied, while data suggests 10% of women will stop working because their perimenopausal or menopausal symptoms are so bad.
Federal funding or research dollars to women's health is not to the same level in general. And a lot of it has to do with quality of life as much as life and death. And so it's harder to get funding.
Fixing the problem, advocates say, will take a combination of education and investment, and more women like Kondofsky willing to move beyond the taboo and talk. Heather Yourex-West, Global News, Calgary.